The COVID pandemic hit, and it was a shock to everyone.
Now to growing concerns about the deadly coronavirus officially hitting
all
the U.S.
had to recreate and re-envision how are we going to work, how are we going to protect our veterans.
The pandemic obviously disrupted this entire community. You had a period when unemployment in the Las Vegas Valley had topped 30%. People who couldn't leave their homes, people were having trouble getting food or basic services. This was a time of incredible disruption.
We don't have staff who are medically trained, and we have 240 veterans that live in this one building together. You know, we were doing the best we could with trying to rotate staff in and out so that we kept a healthy staff and could keep our program functioning, and we were making changes. We were incredibly innovative at that time, but we really struggled with the idea of how in the world are we going to protect from this virus that nobody can see.
COVID testing was always a bit of an inconvenience, right? If you or I were to be exposed to it, it can be an inconvenience to go down to some place to get tested or to try and find an at-home test. But just the process that they had to go through, a U.S.VETS resident to go through, if they needed a COVID test, was off the charts. I mean, this can be an all-day excursion to try and schedule a COVID test, get to a location, get tested, come back, and we were presented with this opportunity to find a resource on site that could take care of these tests. We tell Shalimar, hey, you know, Boyd would like to support you. I think she might have cried, actually, and that was a really neat feeling to be able to share that news.
In addition to having the COVID testing available, which has been really valuable to us, what we didn't realize was how much the veterans really would benefit from having medical personnel on site.
Since Nurse Marty has arrived here, it's a lot more convenient to come down and speak directly to her, and she can direct you from that.
We do first aid, and if the veterans needs to be rushed to the hospital, we determine that according to our assessment.
Now, if someone is having some shortness of breath, we can have the nurse come over with a stethoscope and listen and let us know what's going on. Do they need to sit down? Are they dehydrated? Or is this a heart attack?
We also help them patch up with their doctors in case they have difficulty setting up appointments. Basically, a lot of them just need somebody to talk to, especially those who are suffering from mental health. And just by listening to them, it helps them feel better. It helps them gain better perspective of things.
Having a healthcare professional on site has really helped a lot of the other veterans. They always walk out of her office with a smile, and they're happy with the progress that she's doing to help them.
Now we can allow the nursing staff to do their jobs and to take care of medical emergencies, to take care of COVID testing, and we can focus on what we do best, which is getting veterans housed.
It's hard to think of a greater form, a more impactful form of community service than serving in the armed forces. We owe it to them to support them.